Scuba diving is obviously an equipment-intensive sport. The equipment is what makes it possible for divers to explore and do the things we do underwater. While it is extremely rare that dive equipment itself causes a dive accident, improper use and maintenance of dive equipment is a contributing factor in many accidents. Dive equipment is life support equipment and should be used as such. Many divers tend to disregard their dive equipment until they need it. This causes many problems. The following segments will discuss the role played by dive equipment in dive accidents and how to reduce the risks of accident and injury. There have been no documented cases of disease or infection being transmitted from one person to another by sharing dive equipment. The theoretical risk does exist, however. As equipment moves from one diver's mouth to another, there is a cause for concern. Bacteria and viruses, including hepatitis B, influenza, and staphylococcus and salmonella, can potentially be transmitted from one mouth to the next from regulator second-stage mouthpieces, snorkels, and oral inflators on BCDs. Sharing masks can also potentially be a problem. There are many different types of cleaning solutions that are suitable for application on rubber and silicone dive equipment. Specific types and concentrations are included in your student materials. You should always follow the manufacturer's recommendations on how to mix and apply these solutions to your dive equipment. In general, though, you can follow these steps. To begin cleaning and sanitizing regulators, you should use a scrub brush and wash a regulator thoroughly with a brush and appropriate detergent solution. This detergent should not contain any hydrocarbons. Remove any dirt, sand, saliva, or seaweed from the gear. Then, rinse it thoroughly with fresh water. Following the clean and rinse, spray the regulator down thoroughly with the sanitizing agent and allow it to sit with the solution in place for 10 minutes. There are several sanitizing solutions that will work and are designed for this purpose. They are discussed in greater detail in your student materials. Many people use a 10-to-1 bleach solution, for example. Many viruses and bacteria are killed in less than 10 minutes, but some are hardier, and to make sure, it is best to be patient. If the sanitizing solution begins to dry off during the 10-minute soak, spray it down again to keep it wet. After 10 minutes covered in the sanitizing solution, you should rinse the regulator off with clean, fresh water. Several of these sanitizing agents can also be mixed in quantities that would allow you to soak the regulator for 10 minutes. Allow the regulator to air dry once you have soaked it and rinsed it. It is then ready to return to service. A more direct threat to the safety of divers is the problem with dive equipment. While dive gear has become safer to use over the years, if you fail to maintain it properly or fail to practice using it, you're asking for trouble. According to DAN's statistics, equipment problems were reported in about 6% of dive accidents. This is a relatively small problem and reflects the safety of equipment in general. Even then, many of the problems involving equipment that fails are related to poor maintenance or improper use, rather than an outright failure. The most commonly reported problem in a dive accident is rapid ascent. There are many potential reasons for making a rapid ascent, although one of them is poor buoyancy control, which is often related to an inability to properly use a buoyancy compensator. It is not uncommon for inexperienced divers or those who are using an unfamiliar BCD to mix up the inflate and deflate mechanisms, leading to a rapid ascent. A poorly maintained BCD inflator can stick and cause the BCD to inflate more than expected. Another reason for rapid ascents is finding yourself low on air or running out of air. Sometimes this is due to inattention, but on other occasions it can be due to a faulty pressure gauge. Lack of buoyancy control is not always an equipment problem as much as an experience or skill-related problem. The same can be true for running low on air or running out of air. These problems often revolve around a diver's improper use of equipment in the first place. BCD problems show up in about 8% of dive fatalities, and regulators are only involved in about 4%. In the same way, buoyancy problems are reported in more than 30% of dive fatalities, with rapid ascents in approximately 20%. Running out of air is a problem in more than 25% of fatalities. Dive gear should be serviced at least once a year to ensure it is functioning properly. Seals and O-rings can dry out through misuse and will fail at inconvenient times. If you dive regularly, you may want to consider having your gear serviced more often. And in any case, it's important to inspect it carefully prior to diving. Additionally, if you've been away from the water for a while, it's good practice to take a skills refresher, or at least jump in the water for a dive to practice key safety skills before you take a dive trip or make more aggressive dives. A key to diving safety is the overlearning of critical key skills. These skills need to be so ingrained as a drill in your diving practice that you do not hesitate to perform them. If you haven't removed and replaced your scuba mask underwater since your initial certification course, you should practice it. This is especially important in colder waters, where the shock of a flooded mask can more easily cause panic. You should practice your buoyancy control in a pool or other confined water environment. You should remove and replace your regulator. Each of these skills is relatively simple, but if it has been years since you attempted any of them, you may be no better prepared to complete them than when you first began diving. While the odds of you losing your regulator or your mask underwater are low, if it does happen, you need to be prepared to respond and continue your dive. Often, divers are faced with a relatively simple procedure, but they forget what to do and panic, bolting for the surface. That rapid ascent is the cause of many dive accidents and fatalities. Another seemingly minor problem is a leg cramp or fin strap breaking. Under normal circumstances, both of these would be a minor nuisance, causing you to stretch out your leg or end the dive and replace the fin strap. But in a dive situation where you're struggling with a stronger than expected current and breathing harder than normal, losing a fin might be all it takes to push you over the edge from a dive in control to one in full panic. Often, when panic situations arise, the only viable alternative you can see is getting to the surface. This is a dangerous situation, though, and one brought on totally by a poorly maintained fin strap. The carotid sinus is a pressure sensor inside the carotid artery of the neck, where the artery bifurcates just below the angle of the jaw. Its function is to sense and regulate the blood pressure. If the pressure in the sinus is too high, it will activate mechanisms to lower the blood pressure in a reflex manner. Some divers may have experienced this without even knowing the mechanism. It typically happens when a diver dons a wetsuit or dry suit that fits tightly around the neck, causing pressure on the carotid sinus. The resultant drop in blood pressure can even make a person faint. To prevent this problem, ensure that the size of the suit around the neck is appropriate and that it does not exert pressure at the level of the carotid sinus, but rather lower down. The drop in blood pressure does not lead to any serious physiological effects unless the person has an underlying disease. However, if this occurs in a dangerous environment, it can cause injuries. Unless the diver is wearing a full face mask, becoming unconscious underwater is a serious emergency. A regulator can slip from the diver's mouth and he can drown. Neck seals should be cut to fit snugly and seal properly, but not be so tight that they put pressure on the carotid artery.